Barely 30 and the mother of two, Shawna Roy got the shock of her life back in 2015 when she found out that she had cancer.
I had a biopsy and then a mastectomy. I ended up having to do chemotherapy. So I did chemotherapy in North Bay. I only had to go see my oncologist once in Sudbury, which was wonderful. I did chemotherapy for 4 months, and then I was no evidence of disease. Now I'm just followed every 6 months by my surgeon as well as my oncologist on telemedicine.
And Roy says telemedicine is a godsend on many levels.
Well, I have 2 young kids, so it's fantastic. It means that instead of taking a full day off work and finding childcare, I can leave work for an hour or 2 and be back and not have to worry about making other arrangements.
Shawna, someone who's beaten cancer, what does it feel like? Is it still an ongoing battle, or do you feel it's really behind you?
Well, it's the problem with cancer is it's never really cured, so it's always in the back of your mind, but it gives you a different perspective on kind of your priorities. Yeah, it's wonderful. I'm so happy that we're able to have the facility that we do here. Just gives us a lot of advantages when it comes to the care at home.
The battle, as she says, isn't 100% over. She only needs to visit the hospital twice a year for telemedicine visits.
I just think it's important, first of all, people to know that they're not alone and to realize that the help is here if you need it. I just feel like cancer can kind of be a lonely thing at times, so it's nice to know that there's others out there that are fighting as well.
And as Shawna Roy said, helping out in that fight was the North Bay Regional Health Center's telemedicine department, a rather busy unit.
Telemedicine here at North Bay Regional, probably we see over 50,000 patients a year. The majority of them, 80% I would say, are oncology appointments. So patients will see their radiation oncologist or their chemotherapy oncologist for the first time sometimes if we do not have enough time to get them to Sudbury. So they'll receive sometimes their diagnosis this way or receive their treatment plan. They will often have follow-ups between their chemotherapy treatments to assess how their last treatment went. So originally the appointment is created from Sudbury Oncology or say Princess Margaret. The consultant initiates the appointment and the site calls the patient at home to tell them when their appointment is. So it could be either a phone call or by letter that they receive their appointment. Then they come into our department. The way telemedicine works here is the patient is invited into the room. We review with them how OTN works, how the system works. We get their consent that they want to proceed with their appointment that way. We take their vitals, we weigh them. That's very important for a chemotherapy patient. And then we create their medication list, a complete medication list, and we fax it to the site. So that when the doctor comes on the air, they have as much information about the patient as they need.
And Hunt says the future applications of telemedicine are nothing short of remarkable.
Very revolutionary. Patients really love it this way because they don't have to travel for their appointments. OTN is now expanding their role to look at maybe doing home visits with patients, so they don't even have to physically come to the hospital, that they'd be seen at home using their iPhone or their iPad.